Next week is one of the scariest times of the year for dentists, Halloween. So with all the sugar treats on the horizon, how can we keep our fangs healthy and still have a frighteningly good time?
Well, here with some tricks and treats for our teeth is dentist and founder of Pace Dental, Dr. Derek Chung. Welcome back.
Thank you for having me. Thank you.
All right, so we obviously know that sugary treats wreak havoc on our oral health,
They do.
right? And
They
we're
do.
gonna start with some of the sugary treats that we should be cautious about.
Okay.
And of course, we're starting with the ones that I love the most, which are gummies and caramels.
Me too. Me
Right?
too.
Those are the good ones. So
Yeah.
what should we know?
Okay, first off, I gotta say, I know I'm the dentist, but growing up, Halloween genuinely, honestly, was my favorite holiday. So I want kids to enjoy Halloween.
Okay,
I
good.
loved it. I loved dressing up. I loved playing a character. I loved everything.
Did you eat the candy?
I loved the candy.
Okay, good.
So now that I'm a dentist and I'm the adult, I wanna have kids enjoy the wonders of Halloween, but I also want it to be a little bit healthier. So, gummy bears. That sticky, chewy texture
So good.
sticks to your teeth for a long period of time, so that window of time that sugar is causing cavities is extended. And then we also want to be careful, caramels, really sticky, even more sticky. I've seen it pull off crowns, I've seen it pull out fillings. So you don't want to be going to the dentist the next day with an emergency.
Right,
Okay.
this is true. Okay, that's the chewy stuff. What about hard candies? What do we need to know about?
I think everybody sees this all the time. Somebody bites into a hard candy, they make a huge sound, and I've seen it break dental work, I've seen it break teeth. So if you develop like a vertical root fracture, you break a tooth, sometimes it's not even fixable. So it's not worth
What?
it. The pleasure is not worth the pain.
Not
What about just
fixable.
sucking it and so you don't bite
Yeah,
it?
you can suck on it. So
Okay.
it doesn't stick to your teeth as much, it dissolves quickly,
Okay.
which is great. But that period of time, you're sucking on it for 5, 10, 15 minutes.
Yeah, sometimes you just wanna crunch down on it
Yeah,
at the
that
very
window
end.
of time
Yeah.
where that mouth is acidic, the constant stream of sugar causes cavities even more.
All right, so you have ruined all the candy I like so far, so I'm afraid to ask for this next one. Please tell me I can still have chips.
I used to get chips all the time in my Halloween bag, and I thought that it was like a good alternative. Even though it's lower in sugar, a lot of times it can compress and compact into the little nooks and crannies of your teeth. It ferments into sugar, causes cavities that way. So nothing is safe.
So no chips, no caramels.
Nothing
Okay,
is safe.
okay.
Halloween's canceled, kids.
Yeah, it's canceled.
Blame
Okay,
Dr.
so
Chung.
clearly it's not just about the sugar content at the outset, but what other things should we be looking out for?
So the word of the day, and the word that a lot of dentists use to classify how likely a food is to develop cavities is karyogenic. So a food that is high in karyogenic properties is going to be more likely to cause a cavity versus low karyogenic, less likely. So the first thing that I look for, the most obvious, but the most important, sugar content. So the high sugar foods are gonna be more likely to cause a cavity than the low sugar foods. Turn the package around, look at the nutrition facts. I get surprised about certain foods that I didn't realize have a lot of sugar. The second thing, we chatted about this, that texture, the ooey gooey kind of sticky texture, the longer that food is on your teeth, the more likely it's gonna cause cavities. The next thing, acidity. So those sour, citric acid, white covered candies, they're my favorite.
Sour candies, I love them.
Yeah, so the sour candies, they're more acidic than a sweet candy. So it actually brings down the pH inside your mouth, increases the acidity. So the mouth has a longer, harder time neutralizing back to normal, and it's not ideal. And the other thing, moderation. So those hard candies, kids are sucking on those big lollipops.
Yeah.
30 minutes, 40 minutes. That window of time is extended so long, constant stream of sugar, so the acid is on there for longer.
Okay, all right, so from a dentist perspective, is there a type of candy that is the absolute worst?
So the sour candies, high in acid, covered in citric acid, ooey gooey, sticky texture. My favorite.
Okay.
Those are gonna be the worst for you.
Okay, we're talking about kids, but do these candies affect like adult teeth and kids' teeth differently?
Andrea, what do you think?
I'm so disappointed by everything you've said so far. I don't even have an answer. Whatever you want to say, Dr. Chung, I just know I can't eat anything anymore.
Yeah, so baby teeth have thinner enamel, and it's also a little bit softer. So for that bacteria to penetrate through the enamel, that outer hard protective shell happens much faster. And the nerve on these teeth, really big compared to the size of the tooth. And so for that bacteria to penetrate straight to the nerve, cause an infection, happens more quickly. So we really want to be careful. If you see a hole on a baby tooth, if you see a dark spot, take your child to the dentist, get it treated quickly, because things can really develop over a short period of time.
Okay. Okay, so how do we have a happy Halloween then, Dr. Chung? What's your recommendations then?
Okay, so a few things that I recommend to my patients to make Halloween a little bit healthier. Obviously, limit the amount of candy. So maybe a smaller bag, smaller pillowcase. I recommend, and I like those plastic pails, those cute little plastic pails. Not too much candy, but enough where the kid can still enjoy trick-or-treating. I would say pair the candy with a meal. So right after dinner, right after lunch, so we tighten up that window of time where the body and the mouth is under an acidic environment, causing higher cavities. I would way rather that than a child be grazing over something with even less sugar over like a movie, because acidic environment for 2 hours is no good.
Okay.
The other thing, I want to make sure that at the end, so you give them a couple treats, pair it with some celery sticks, carrot sticks, something hard, high in water, low in sugar. It'll act like nature's toothbrush. It'll scrape away some of that sugar and help to dissolve some of that bad stuff.
Okay, that's good advice. You guys like that? All right, so does sugar-free candy actually make a difference?
Yeah, so I actually like a lot of sugar-free candies that contain xylitol and erythritol. So I'm seeing those more at the grocery store now. It's a naturally derived sweetener. So it's sugar-free, it's called a sugar alcohol, but it has dental benefits. So it actually induces more saliva flow so that the teeth can cleanse off. And then it also helps because the stickiness of bacteria is reduced. So the bacteria that cause cavities, it doesn't stick to teeth as much. It doesn't stick sugar as much. And then so it has a great dental benefit. And a pro tip, so parents, what you can do is, I want kids to enjoy those Halloween classics with lots of sugar. You can mix in these erythritol, xylitol sweetened candies, so they're getting a dental benefit at the same time, maybe negating some of that classic Halloween sugary type candy. Mix it together.
Offset it a little bit. Okay, besides sugar-free, what other healthier alternatives exist?
So I would recommend plain chocolate, dissolves quickly, doesn't stick to teeth. I think everyone enjoys chocolate.
Loves chocolate.
Dark chocolate, yep. Dark chocolate, turn the package around. A lot of dark chocolates have less sugar. And the powdered candy, so the pixie sticks, the rockets, those dissolve quickly and then they don't cause cavities as much.
Okay.
Okay, great. Dr. Chung, thank you so much for coming by and giving us some very important information. Happy spooky season, everybody. Thanks for all the great tips.
Of course.
Stay with us, we'll be right back.
Hey you, come a bit closer. We've got so many more must-see interviews, spicy debates, lifestyle tips, and pop culture moments. So subscribe to our channel by tapping the logo below and don't miss out.